So I'll start in the order that I have you on the list, Mr. O'Hara.
Thank you. Thank you, Senators, for the invitation to speak to you today. My name is James O'Hara, and I'm the President and CEO of Canadians for Fair Access to Medical Marijuana. Before I begin my remarks, I would just like to say this is a very special day for me. On this very day in 1974, Victoria Day, the 24th of May, I first arrived in Canada from Scotland as a wee lad. I want to take this opportunity to recognize and sincerely thank Canada and the Government of Canada for welcoming me to this country as of this day, my home now, for 44 years. It is with humble gratitude I sit before you today and appreciate the opportunity to talk to you about how we can make this wonderful country even better.
Accent, though.
A little bit. CFAMM is a national nonprofit organization which has successfully represented medical cannabis patients since 2014. With a membership of over 20,000 Canadians, the organization has emerged as a thoughtful, legitimate, grassroots voice for medical cannabis in the nonprofit advocacy space. I'm a former bank vice president, and for many years now, I've also been a medical cannabis patient. I have a number of conditions which I successfully treat using medical cannabis, including focal seizures, osteoarthritis, and chronic asthma. The use of medical cannabis in my life has been utterly life-changing, and I mean life-changing. I've been able to reduce the number of seizures I have by about 80 to 90%, and my overall quality of life has increased dramatically, and I am far from alone in my experience. It's with this thought in mind around the legalization of recreational cannabis in C45 that it's important for us not to lose sight of the needs of patients. We have had a system of legalized medical cannabis in Canada for a number of years now, supporting patients with legitimate medical needs and who are treating their conditions and symptoms with the support of competent healthcare professionals. Now let me touch on some of the challenges. There are indeed challenges with the medical cannabis system, and a significant one is that many patients can't afford to get the medicine they need. As advocates for patients across the country, we want to make sure the government's move to legalize recreational cannabis doesn't compound or worsen these challenges medical cannabis patients already have and are struggling with today. Today, over 250,000 Canadian medical cannabis patients get relief of symptoms from various conditions and illnesses, including pain, headaches, anxiety, sleep disorders, MS, Crohn's disease, and epilepsy, just to name a few, which is why it's of critical importance that the ACMPR medical cannabis system be supported and continue into the future. In crafting Bill C-45, we want to commend the government for recognizing the need to maintain a separate and distinct regulatory approach for medical cannabis, and we want to ensure that this is maintained. Beyond the government's constitutional requirements to provide reasonable access to cannabis for medical purposes, patients have unique considerations that can best be met in a distinct regulatory regime. Moving forward, beyond Bill C-45, it is important that the government prioritizes and adequately supports the needs of patients by addressing their unique requirements. Among these requirements is the need for integrated end-to-end health care where a patient can have a conversation with their doctor all the way through to their pharmacist. Patients must be free to discuss medical cannabis as a treatment option with their primary care physician as they are with any other conditions today, while understanding any potential medical or medication interactions that they may face. In addition to the continuation of mail order today, we believe pharmacies should have the authority to retail medical cannabis, and further product forms should also be made available. Sales and consultation through pharmacies will help ensure that patients across Canada can access their medicine easily and can receive reliable education on the safe and effective use of medical cannabis from trained healthcare professionals with regulatory oversight. This is not only of significant importance today, but especially in the future as age demographics of our population dramatically change. Very soon, we will have more older Canadians than young, and this brings with it a seismic shift in healthcare needs for this country. You've already heard this morning, but let me underscore from a patient's perspective that affordability of medical cannabis remains an urgent crisis for the majority of patients, as fully 60% of these patients cannot afford their full dose. Insurers rarely cover the cost of medical cannabis, and the majority of patients' expenses are out of pocket. Again, this will become a critical demographic issue as more and more Canadians will be on fixed incomes. Also keep in mind, this is a medicine whose cost is already significantly burdened by HST, and it shouldn't be. Other medicines in Canada are zero rated and not subject to any tax. And to compound this situation, Just this week, the government passed yet another tax for medical cannabis patients, an excise tax, or what is commonly described as a sin tax. To disincentivize the responsible management of someone's medical needs makes absolutely no sense, and applying a sin tax to medicine is completely out of line with our collective moral beliefs and principles as Canadians. It's important to recognize where cannabis tax revenue has been coming from up to this point, and that is medical cannabis patients. Essentially, the government is telling patients it wants them to pay excise and consumption taxes to help pay for education and enforcement for legalization of recreational cannabis. This is an unprecedented approach and wholly inappropriate for patients. Think this through. The government is funding education and enforcement to fight the opioid crisis, but they're not asking legitimate patients to use opioids to pay for those efforts. So why are they asking this of cannabis patients? Finally, on a related topic, affordability is one of the reasons why we also support personal production, and that is to give patients who struggle financially the option of producing their own medicine. I have three main asks today. One is that CFAMM supports cannabis research and education initiatives. However, that should not be paid for on the backs of patients who are already carrying significant burdens today. Two, the government should do all it can to facilitate insurance coverage for medical cannabis. This is a big issue and confronts many, many patients today. Finally, remove all taxes for medical cannabis. Thank you, and I'm happy to take your questions.
Thank you.